Go ahead and get started. Good morning, good afternoon now, actually. My name is Chris Bruni. I'm the Vice President of Sales for Security Health Plan, joined by my colleague and co-host Jeff Tucker, who is the Vice President of Business Innovation for the Marshfield Clinic Health System. So we are very pleased to once again bring you another installment of our webinar Wednesday here with the Marshfield Clinic Health System. And we are very pleased to have Miranda with us today. Jeff will actually be taking the introductions of Miranda when I finally do hand him the baton, but for now, I'm just going to go through a few of the nuts and bolts like we normally do here. Miranda, I just do want to add that I do have a bandage under my sleeve here, so I did get my flu shot this morning. So if you haven't gotten your flu shot yet, everybody, it is the season, and Miranda will talk a little bit more about that. But for those of you that are attending today, again, thank you for participating. We do want to make these all about you. So Jen is our host. Jen Kiefer is our hostess here, and she will be sending out this presentation when it's concluded. It'll be posted to our website as well. But if you did pre-register, you will get an email with all the slides and the presentation, and that will come out generally within about 24 hours at the conclusion of our presentation today. There is a chat feature and a Q&A section up there in the upper right-hand corner of your screen. Please feel free to use it. Those will be questions that you can ask of our guest today, Miranda, and we want to make sure that we do address every question that comes in. So if there are more than we can handle during our brief time together today, we will make sure we get those questions all answered, and they will go out again with what we email out to everybody. And again, for any of you that either lose the email or want to get access to this presentation or any of the others that we've done, you can go to the Security Health Plan COVID page. We have a COVID-19 page out there. Go there, click on the Employer tab in that section, and it will bring up all of the past presentations, including this one that we have done, and feel free to peruse them at your leisure. Following this, we do a survey as well. We do want to make these about you. Please tell us if there are topics that you want to hear more about. We are more than happy to go through our universe of great staff that we have throughout the system and find experts that can talk about any topic, medical related, health insurance or otherwise. So please give us that feedback. We want to make this all about you. And with that, I will be handing the baton to Mr. Tucker, and he will take us away. Thank you, Jeff.
You are welcome. I was hoping you'd take a little bit longer because I was just looking for an email on an exciting webinar series coming up next week, and Jen was kind enough to send it. So I'll mention it here actually I'll mention it now before I forget. So next week, our research institute will be conducting a 5-day series of 1-hour webinars on precision medicine, and that's an area that I personally find very interesting, and it was actually one of the strong points for that I felt for our system when I was making the decision to come here. And I'm just going to read you real quickly the intro to the email announcement, and we can send out more information on this. But precision medicine is healthcare tailored to you based on the DNA you are born with, your diet, exercise, environment, and many other factors of your health. Marshfield Clinic Health System is a pioneer in this research. So next week, they're going to be doing a webinar series to talk about that. And I just find the field truly interesting on how it's basically healthcare tailored to you. So if you have time next week, I encourage you to look into that webinar series. Again, we can attach the information when we send out the follow-up to this webinar. So without further ado, Miranda Egebred will be presenting How Will Flu Season Be Different This Year and How Should Employers Respond? She's a clinical quality nurse specialist in the Marshfield Clinic Health System Institute for Quality, Innovation, and Patient Safety. And she'll be doing an update on all the aspects of flu season and the COVID-19 pandemic that's occurring simultaneously this year. She'll cover the upcoming influenza season, getting the flu shot, how you can schedule a flu shot clinic at your workplace, and our health system's response to the influenza season and more. So with that, I will turn it over to you, Miranda.
Thank you so much, and thank you everyone for having me this morning. As Jeff said, my name is Miranda Egebrecht, and I work in our Institute for Quality, Innovation, and Patient Safety. One of my roles in this department is to help to coordinate vaccine efforts across our health system. So as part of that work, every year I get to help coordinate our influenza season. And that's working with all of our players to make sure that patients and community members receive influenza vaccine. So this morning we'll be talking about influenza season during this COVID-19 pandemic and any implications that it has. We're going to start out with what we know now. And so this slide just high level covers what we currently know about COVID-19 and what we currently know about influenza. We know that both are contagious respiratory illnesses. Both are caused by different viruses, but they can definitely lead to illnesses leading to missed school and work days, hospitalization, and death. And we've all seen that in the numbers that are reported with COVID-19, and in prior influenza seasons, we've also seen that as well. Many of the symptoms of COVID-19 and influenza overlap. Similar symptoms include fever and chills, cough, shortness of breath or difficulty breathing, fatigue, sore throat, congestion, body aches, and headache. There are some symptoms that are a bit different. So for example, COVID-19, we've seen a loss of taste or smell, and we don't typically see that with influenza. We also know that onset of symptoms is a little bit different. So historically, you may have heard folks with influenza say they feel like they've been run over by a bus. So that very rapid onset is a little bit more unique to influenza, but certainly a majority of the symptoms do overlap. We also know that both are contagious. They're spread primarily from person to person in close contact and through the air, so coughing, sneezing, talking, and conversing with one another. We know that there are populations that are at higher risk for complications of both illnesses. Groups like our older adult population, groups that have chronic medical conditions or are immunosuppressed, and those who are maybe disadvantaged, or we see higher disparities for the illness. We have several licensed vaccines available for influenza and have been available for years. We do not currently have a vaccine for COVID-19, though trials are underway. So each year we try to learn here in the Northern Hemisphere about our upcoming influenza season based on what our Southern Hemisphere countries experience. So what we've seen so far is data that's been reported to the World Health Organization from 3 of our Southern Hemisphere countries is that they've actually had a decrease in very low influenza activity during their season, which is typically in our summer months. But we also know that they've had very extensive community mitigation measures in place for COVID-19. Much stricter shutdowns, face masks, social distancing, school closures were all in effect. And we know that those mitigation measures likely played a factor into that decrease of spread of influenza virus and that low influenza activity that was as a result. So given that the COVID-19 pandemic is still relatively new, that we don't know much about it and how it's going to interact with our influenza season in the Northern Hemisphere, and given that our community mitigation measures are a bit different than the countries that had reported influenza activity to the World Health Organization, we know that it's important for us to plan for this upcoming season as if it's going to be similar to influenza seasons that we've seen in the past or potentially more severe. So as we start to plan, and as we've been planning for the past several months, we know that the annual influenza vaccine is going to be even more important this year than it has been in prior years. And again, that's because we have both the pandemic occurring at the same time. So SARS-CoV-2, which is the virus that causes COVID-19 and influenza, will be co-circulating. And this means that since both cause a respiratory illness, we want to vaccinate folks to avoid overwhelming the health systems with another respiratory virus. We also don't have much data as of now on what kind of impacts co-infection of both influenza and COVID-19 have on an individual. We do know that individuals can be infected with both viruses, but what we don't know, again, because of some of the low influenza activity that we've seen elsewhere, is what kind of long-term impacts that has and even short-term impacts that has on individuals' health. So we want to avoid that as much as possible with influenza vaccination. Vaccination can also help to avoid possible misdiagnoses, and it reduces the number of individuals who need isolation. So again, because influenza and COVID-19 have symptoms that overlap, currently the recommendation is that anyone with any COVID-19 symptoms be isolated until they have a negative test result, or if positive, until they extend the length of their time-based strategy. So through influenza vaccination, if we can reduce the amount of influenza activity, that then reduces the amount of individuals experiencing influenza symptoms who may require that isolation, which then is more school and work days missed. How have we been doing with influenza vaccine? In our the data that we have is from last year. The graph here shows our state of Wisconsin by county and our influenza vaccination rates. You can see there's areas that do or have done really well and some areas that have some opportunity. Our greatest performing county was Dane County at 54% last year, and our lowest performing county was down to 28% of folks vaccinated for influenza. So again, we do have some work to do. These rates have been improving over the last couple years, and similar rates for the entire United States has been improving. The United States last year sat at around 52, just under 52% for influenza vaccination rates. So you can see Wisconsin is a little bit under that, but not too far off. And again, in the United States, last year that was an increase of 2.6 percentage points from the prior season. So advancements have been made in terms of influenza vaccination. But again, there's work to do. Even with those vaccination rates last year, we saw over 36,000 cases of influenza in our state. Of those, we had over 4,400 flu-related hospitalizations and over 180 deaths, and that includes 3 pediatric deaths, again, just for the state of Wisconsin. Our Healthy People 2030 goal for influenza vaccination is 70%. The higher percentage of folks that you can get vaccinated, the better that community immunity or herd immunity is. So the more folks that we have protected is beneficial for all of our communities. Each year, the Advisory Council on Immunization Practices comes together to put recommendations for the upcoming influenza season together. These recommendations are then reviewed by the CDC and published. This year, the recommendation for influenza vaccine is that all persons 6 months and older receive influenza vaccine. And this includes some of, again, our higher risk populations. It also includes women who are pregnant, who are hoping to become pregnant or are postpartum. And it includes people who have an allergy to egg. There are some caveats to the allergy to egg, though the bottom line is that even with an allergy to egg, all folks should receive influenza vaccine. There are a few products that are egg-free, Flucelvax and Flublok, and those can be administered outside of an outpatient or inpatient medical setting. But if a vaccine is given other than the egg-free vaccine, and the patient has had a reaction to egg that requires emergency medical intervention or epinephrine, that vaccine should be given in an inpatient or outpatient medical setting and supervised by a provider who can manage allergic conditions. So here at our health system, we have a variety of flu products available, but our principal product is the Flucelvax, which is egg-free. And again, that's just to reassure our patients that it is safe to receive that vaccine and to encourage all folks to get the vaccine, even if they have an allergy to egg. The timing of influenza vaccine is important as well. We want to make sure that folks are getting vaccinated before influenza activity starts, but not too soon that any vaccine-induced immunity may wane by the end of the season. So the recommendation here is to vaccinate by the end of October. Now, if you do not get your vaccine by the end of October, we continue to recommend that as long as there's viruses circulating, and most years that happens well into the spring. So we'll continue to vaccinate and strongly recommend that folks get their vaccine in November, December, January, and beyond. For some of our younger kiddos, if they had not previously received 2 doses of influenza vaccine, they are recommended to receive 2 doses. So we ask that the first dose is given as soon as possible so that we can give that second dose again by the end of October. It takes about 2 weeks for the body to build antibodies to influenza after vaccination. And again, that's why one of the reasons why timing is important. We want to make sure that after receiving vaccine, we give our body enough time to build up those antibodies to have that full protection, again, before influenza activity begins. I mentioned earlier that there are several types of flu vaccines available. So I wanted to give a snapshot of what kind of vaccine options there are this season. Again, very high level. There's a standard dose flu shot, which is typically what most people see, but that's in comparison to our high dose flu vaccines. High dose flu vaccines are approved by the FDA for people 65 years and older. Our high dose flu vaccines have 4 times the antigen in the vaccine, and they're designed for people 65 years and older because typically what we see in this age group is not as much of a strong immune response to the vaccine. So the higher dose of the antigen allows for a boost in their immune response so that they can have that same protection in their age group compared to folks receiving the standard dose flu vaccine who are in the younger age cohort. There's also shots available that are made with an adjuvant who are also approved for 65 and older. There's shots made with virus grown in cell culture. So again, that flu cell vax that I had mentioned earlier is egg-free because that virus is grown in the cell culture versus an egg. So no eggs are involved in the production of that vaccine. Recombinant vaccines are also available. They're made using a vaccine production technology, again, that don't require having a candidate vaccine virus sample. And lastly, we have live attenuated influenza vaccine, which is a vaccine made with a live virus that's been weakened. That's given by nasal spray. So FluMist is the vaccine product here for live. And that is approved for folks who are 2 years through 49 years. The important takeaway here is that CDC does not have a preference on vaccine type as long as it's a licensed and age-appropriate vaccine. So again, when we think about high dose or some of our other vaccine products, CDC isn't recommending high dose over standard dose flu vaccine for 65 and older. The bottom line is that folks are vaccinated with any of these vaccines as long as it's approved for their age group. So what are some of the reasons to get a flu vaccine? We have data every year, and I wanted to share some of these key takeaway points for you. Based on last flu season, flu vaccine prevented an estimated 7.5 million illnesses, just under 3.7 million medical visits, 105,000 influenza-associated hospitalizations, and 6,300 influenza-associated deaths. So flu vaccine is effective. It works, and it helps to prevent illnesses and other complications. When we think primarily about employers and their population, who they serve, we can talk about some data from the 2018 through 2019 season. Of the total population that year who got influenza, 60% were working age adults. 17 million workdays were missed due to influenza. And influenza cost the average person about $130 in medical costs and over $1,800 in lost wages. So that impact is substantial. When you're looking at, again, a hardworking employee, the effects of influenza are not that great. And again, when you tie that together with our pandemic, knowing that symptoms of influenza can lead to more isolation and more missed days due to that isolation and quarantine requirement, those numbers can be compounded. So what has our health system done to respond to this? Our approach to influenza vaccine clinics have been modified. We want to ensure that we're maintaining physical distancing, we're reducing the number of folks that we have in our buildings to decrease that risk of transmission, and following other safety precautions in regards to COVID-19. So what we've done this year is we're trialing a few different innovative influenza clinics. We have a drive-through pilot that's happening so we can test kind of the processes involved with patients driving up to our clinic, staying in their car, and getting their influenza vaccine. We're also piloting a mobile office in a parking lot. So again, folks who are coming in just for their vaccine can go to a completely different area in the parking lot without needing to come into our building. We have appointments for most of our locations. And again, this is so that we can maintain the number of folks that we have in our building at one time. And for our patients, it also reduces that wait time that they may have experienced in the past with some of our walk-in clinics. To help to facilitate this, we do have self-appointing as an option for our patients who have the My Marshfield Clinic portal. So they're able to go onto their portal and set up a time that works well for them in the location of their preference to get their flu shot. Our marketing campaigns are really circling around the importance this year of getting influenza vaccine. So again, really highlighting on the fact that we do have a pandemic going on in the background and to really help folks to protect themselves and protect others. We also are marketing the different options that we have available and making sure that patients know that they can call us to see what works best for them and meet their needs. We've also had an increased response to workplace clinics. Again, we understand that our employers are also interested in more flu vaccine options for their employees and are working closely with them. And I'll let Chris talk a little bit more about this here in a minute, about how to schedule a flu shot clinic at your workplace. So again, there are a number of things that we're doing, knowing and recognizing that influenza vaccine this year is more important than ever. We want to increase the amount of folks who are getting their influenza vaccine to protect themselves and to protect others. I'll turn it over here to Chris, and then I can open it up to questions. Thank you.
Thanks, Miranda. Yeah, we would love to have any of you as an employer group that are looking to get a flu clinic set up at your shop. The drive-through clinics are really, really convenient, and it's great to just have that set up right in your parking lot. So we did that here at the health plan. I'm in my office today here at the health plan. I'm working from home for most of the last 6 or 7 months. So it's a rare occasion for me to be here in my office today, but took advantage of our drive-through clinic as I had to come up here for other reasons anyway. But if you want to give us a call at 1-800-498-5514, that is a connection to our Business Health Solutions sales team, or you can just contact your account manager here at the health plan, at Security Health Plan, and we can get you set up that way as well. You can also contact us through email, so businesshealth@marshfieldclinic.org. That's businesshealth@marshfieldclinic.org, and they can that will get you in the queue as well, and we'll give you a call back and set that up. And then Jen will actually we have a nice little one-page flyer. We'll send that out with the meeting notes so that you have all this information as well. Again, flu clinic is one of those things that you think, oh, wow, it's just the flu, right? But all the different complicating factors that come from it. And Miranda did a great job of outlining just the lost time and lost wages for employees. What an impact that can be, and especially in this time when we're down because of the pandemic anyway, potentially. So better to just stay on top of all these things and get this taken care of. We'd love to see that vaccination rate climb a lot faster than 2-point-something% per year. Let's get way above that 70. So that's a question, Miranda, that we do have for you is, why don't people get the vaccine? I mean, it's easy. I mean, there's drive-through clinics at pharmacies. We've got drive-through clinics. We can put it in employers. You can go to your provider and get it. I mean, the flu is generally available almost anywhere people want to go as far as the vaccine for it. So why don't people get the vaccine?
Yeah, we hear a lot of different things from patients as to why they don't. One of the things, Chris, that you just said kind of hits the nail on the head with, oh, it's just the flu. Oftentimes we're hearing from patients that they don't think that, number one, flu is serious, or two, that they're at risk for flu or flu-related complications. And so a lot of what we do is that education piece to relay that, no, it is around us and it has some negative impacts on folks. And so like you said, we want to reiterate that it's easy to do. To get the vaccine is something simple that folks can do to protect themselves. We've also heard, a number of other misconceptions, such as, well, I always get sick when I get the flu shot. And the fact there is that the flu shot can't give you the flu. It's made, again, with dead viruses besides the live virus, but again, that's weakened. So you can't get flu from the flu shot. So there's a variety of different things that we hear, and our message is really, it's important, and we want you to get vaccinated.
Great, thank you. Another question that did come up is there there's obviously not a vaccine yet for COVID-19, and we know that all the media is talking about how they're working on that. You mentioned it in your presentation as well. But there obviously is a flu vaccine. Granted, it's not 100% effective, but it's pretty high efficacy rate. So is there a shortage of getting the flu vaccine out there, or is it readily available for anybody wherever they are?
Yeah, manufacturers this year have really ramped up production of the flu vaccine. Again, knowing that this is an important year, more important than in years past because of the pandemic. So manufacturers have increased their supply and are getting those out to folks. So there should be flu vaccine available pretty well throughout communities. We do encourage you, though, to call your primary provider first to make sure that they do have products available. Some of our products, like the high-dose flu vaccine, and even sometimes our products for our younger kiddos, depending on the supply and how that's shipped out from manufacturer, you can see kind of some differences in the supply throughout the season. So we do encourage you to check beforehand, or if there's a walk-in clinic, be rest assured that they do have products available.
Great, thank you. And again, we've got tips if you want to set one of these up at your own employer work site. Please contact us. The medical staff have tips for how to make this a really good and smooth experience for you and your staff. You don't have to have your employees all lined up, 20 cars deep in the parking lot waiting to get their flu shot. You can have it organized pretty well. Today we did it here at the health plan over a number of days. We're doing it here for our own employees. I think I was the second car in line, and I was actually, the only reason I was in line was because I got there 4 or 5 minutes before I was supposed to. So that's why I had to wait about, all of maybe a minute and a half before I was able to drive it forward and get that taken care of. So please do. It's not that painful. Get the shot. It's worth it. What's that old famous saying? An ounce of prevention is worth a pound of cure. Get it. It's definitely worth it. So Miranda, thank you very much. We are basically up against the clock. So Jeff, unless you have other questions out there that I missed.
We did. We had a two-part question that came in from the Eau Claire Leader Telegram from Sarah. I don't want to mess up your name, Sarah Seifert. Okay, and I'm going to read it. It's a two-part question. Does Miranda have any tips for distinguishing between symptoms of influenza and COVID-19 this winter? That's part one.
So we don't know without a test whether symptoms are indicative of COVID-19 or influenza. Like it said, there are some things that maybe are more closely aligned with influenza or COVID-19, but there's no way of knowing without a test. We encourage anyone who has any of the symptoms that I had mentioned to call our nurse line, who can then do a further triage and get set up for testing if that is indicated.
Thank you. And the second part, also, is there any worry about hospital resources being strained this winter, given the typical hospitalizations every flu season?
Yeah, that's definitely one of the reasons we're encouraging more folks to get vaccinated is to reduce any potential strain on our healthcare systems. As mentioned, we know that influenza, every year we see an increase in hospitalizations with that respiratory illness, and certainly we're seeing the same with COVID-19, an increase in folks with respiratory illness requiring hospitalization. So absolutely, we're trying our best to plan and prepare for that. But one of our strategies is making sure that all folks know the importance of getting the influenza vaccine and are doing that in a timely manner.
And then,
And
Miranda,
Chris,
there was
that is
one
all the
other
questions
question.
I see.
There is one other question that just came in, and that is about how it's covered. I'll take care of that one. Check your employee benefit plan. The question really came in is the vaccine covered by insurance or does the employer have to pay? It really does depend on who the carrier is and your benefit plan, because every employer can have a unique benefit plan. So we can't answer that question just broadly for everybody, but many insurance plans do cover the flu vaccine, and so it's already part of your benefits in most cases, but not necessarily in every case. So do check your benefits and verify that. But again, great question. But even not covered, the flu vaccine is not a very expensive vaccine to get. So, but again, most of the time it is covered by your employee benefit. Oh, and follow-up question to that is, how is it processed for payment? Well, that would be a claim. So if it's covered by your employee benefit plan, it would be a claim that will be processed by that provider right through the insurance. So therefore, you should see no out-of-pocket for it if it's covered by your benefit in general. Great questions. All right, we're now past our time. So Miranda, thanks again. Great information. Thank you everybody for attending. We do appreciate your attendance and the questions coming in from the audience. Always love to have those as well. So keep them coming, and everybody be well out there. Have a great going into the fall season here.
Thank you.
Thanks, everyone.